It's amazing how many people do not go to the dentist. In fact, certain estimates say anywhere from over 50% all the way up to 75% of patients never visit the dentist on a routine basis. They've done studies to try and figure out why this happens. And there's a variety of reasons that have been identified. The main one seems to be no perceived need for some people. You know, nothing hurts, why should I go to the dentist? There's also the concern about inconvenience. I don't have the time. I have to take time off of work. And there's cost concerns. Now, we've identified some of these in previous DVDs and addressed them. Why it's not a good idea to wait until it does hurt. We've talked about some of the cost issues and methods that patients can use to minimize their dental health care costs. I think one of the biggest reasons, if not perhaps the biggest reason, that people put off going to the dentist is simply fear. And fear is a normal response. Years ago, dentistry, you hear stories about how people had to have a knee on their chest when they had their teeth extracted and how the teeth broke off and got infected and so on and so forth. Well, that was yesterday. There are tremendous advances and have been over the last number of years in both technology and treatment techniques. We now have dental procedures that are truly minimally painful. We have new technology. We have new technology that allows very atraumatic treatment of teeth. We have minimally invasive techniques. You know, the day of the drill is being replaced by the day of the laser and the day of air abrasion. And all of these treatment modalities offer a tremendous benefit to the patient. We have new preventive techniques. We have the fluoride varnishes. We have the saliva testing that can be used to identify dental problems very early on when they frequently can be treated totally non-invasively. We have bonding materials. We have a whole plethora of techniques and materials that make dentistry totally different than it used to be when we were growing up as kids. But we still have the fear issue. A lot of patients did not go to the dentist when they were children, and so their reality is what they've heard from their parents, or they've heard from their neighbors, or they've heard from their significant others, and that's important. It's keeping these people away from having the dental treatment that they need to prevent more problems as they get older. So for the truly fearful, we have a number of options. There's anti-anxiety oral medications that can be used. This takes the edge off, so to speak, so that people can lay back and relax. We have nitrous oxide, which some people have been familiar with, and that works well in many cases. These are the types of procedures that can be done, or techniques that can be used that eliminate the need for IV sedation, and so on and so forth. We have music, we have headsets, but for the truly fearful, we do have IV sedation as a treatment modality in dentistry, and that allows people to be flying about 40,000 feet, not remembering what happens and not caring. So for certain procedures, that is a good way to go. There's new technology on the horizon. You know, hypnosis has been used quite successfully for a number of years, as has biofeedback. One of the new arenas is brainwave modification using certain sounds and stimulations. The NewCom system is an example of that, which allows people to be very relaxed throughout the procedure. So the bottom line is this: don't let fear keep you away. Let's address the dental problems while they're early and easily and inexpensively fixed. If you want more information, please contact us at Expressions Dental.